So the current problem, as I see it, is not the triple-demic. As Kathy Parinello will explain, it is a more systemic concern related to the availability of nursing home beds in our community. By law, hospitals cannot release nursing home patients unless they have a nursing home bed to go to. Unfortunately, our hospitals are having increasing difficulty finding open nursing home beds. So nursing home patients are waiting in hospital beds that should be available for hospital patients who need them. So let's now shift to what could happen. We are already seeing an early and severe RSV season. All signs are pointing to an early and more severe influenza season. And as we have experienced in the past 2 winters, a COVID surge is also a good possibility. This hence the so-called name triple-demic. This means that our limited hospital capacity could become even more strained, and it could happen very quickly. And so that's why this is a very serious concern for all of us. So what can we do as county residents? Most importantly, if you are eligible, which most people 6 months and older are, get vaccinated for influenza as soon as you can. If you are eligible for a COVID vaccination or booster, get that too. It is safe to get both shots at the same time. These vaccinations will go a long way toward keeping you and your loved ones out of the hospital. It is also very effective to wash your hands and or use hand sanitizer often during this time of the year. It removes germs that can make you sick. And as we saw during the last 2 years, when the flu was nearly non-existent, masks can help prevent the spread in public spaces. So consider wearing one, especially if you are at risk for severe influenza symptoms. And finally, please stay home if you are sick. Keep your children out of school and childcare if they are sick. Even if you or your family members tests negative for COVID, you should still stay home if you are coughing, sneezing, feeling aches, or feeling fevers. This is how we are going to keep more people out of the hospitals and help our hospitals through this difficult period. So with that, I'd like to turn things over to my colleague, Kathy Parinello, Executive Vice President and Chief Operating Officer at Strong Memorial Hospital.
Thanks, Mike. And just to put what Dr. Mendoza said into context, hospitals in the Finger Lake region, and especially in Monroe County, have fewer inpatient beds per 1,000 than any other place in New York State or lower than the US average as well. For example, Strong Memorial Hospital routinely operates at about 100% occupancy. For the past month, Strong has consistently been over capacity. So we have 886 licensed beds, and on any given day, when we arrive in the morning, we can have upwards of 1,000 patients admitted and waiting for a bed. A shortage of available nursing homes, as Dr. Mendoza just said, is the #1 reason Strong and the other hospitals in Monroe County are facing this challenge. We all have large numbers of patients who are medically stable and no longer need to be in a hospital, but they need additional nursing care in a nursing home or from a home care agency. For example, in October of 2020, Strong was caring for about 20 to 25 patients awaiting nursing home placements. That is pretty typical for Strong Memorial Hospital as we prepare patients for discharge. Last year at this time, we were up to about 50 patients in the hospital waiting for nursing home placement. This month, the average number of patients waiting for nursing home placement at Strong alone is 100 patients. And at Highland, on any given day, it's over 30 patients waiting for nursing home placement. Very important to note, however, we do not fault our nursing homes for being unable to take these patients. The nursing homes are also dealing with staffing shortages and Medicaid reimbursement rates that do not adequately cover the cost of the care they need to provide to these patients. Recently, the county has approved more than $13 million in grant funds to support nursing homes who take hospital patients after discharge. We're grateful for their partnership in this. Some of these grant funds will go towards helping to train certified nursing assistants to staff in nursing homes. other of these funds will go to actually support the nursing homes who take these difficult patients. In the meantime, we're working with the state health department, who has also agreed to launch a task force of individuals from our community to address and deal with this issue. Next, I'd like to introduce Dr. Rob Mayo, who's going to talk with you about the situation at our partner, Rochester Regional Health System.
Thank you, Kathy. It's a pleasure to be here with Doctors Mendoza, Apostolakis, and Kathy Paranello. Thank you also for sharing our message to the public from our friends in the media. Today, we are painting a picture for you of a comprehensive overview of our current health status. So I'd like to talk about the impact of our current challenges on our emergency departments. Members of the community who have recently been in any of our emergency departments understand that they can be very crowded. The crowding of emergency departments is a major concern for all of us because patients who present there need urgent or emergent care. The crowding of emergency departments at times can be related to the backup of patients within our hospitals who are awaiting discharge. But other times it can be related to patients who are seeking care, but actually don't need full emergency level services. So we'd like to ask you to firstly be patient, but also be clear about your symptoms so that the nurses and doctors who are caring for you understand the level of triage that you need to get your care, as well as communicate with your primary care doctor to have their assistance in helping you decide whether you need to go to an emergency room or whether your care could be provided within their office or at an urgent care. Above all, we will not turn anyone away from our emergency rooms, and we do not want you to delay emergency care. So we ask for your assistance and are grateful to care for your needs. Some of our challenges also have extended not only from adult care, but into pediatric care. Both the Golisano Children's Hospital and Rochester General Hospital have had a large census of pediatric patients. This has also been related to the infectious viruses that Dr. Mendoza mentioned, RSV, flu, and some COVID. We've seen, you've probably seen on national news how some hospitals in other regions have been trying to cope with this, and we too are doing our utmost to provide high quality care that we expect of ourselves and that our community expects of our healthcare systems. So how can you help? Ensure that your children are vaccinated. The vaccines for flu and COVID are well tested in pediatric populations, especially as the holidays come and colder weather and we spend more time indoors in closer proximity to others. Infectious diseases can spread more quickly amongst us. This year's flu shot, we believe, is effective, and as well as the new COVID bivalent vaccines, which are now available. So also remember that there are many other upper respiratory viral infections besides these three that we've mentioned today. And so even if you have negative test results for these conditions, you still should attend to your symptoms of illness. So if you're feeling ill, but you test negative, still take the necessary precautions. Stay at home, wear a mask, be attentive to hand hygiene, and be in touch with your primary care doctor. I'd now like to turn the time to Dr. Michael Apostolakis, the Chief Medical Officer at the University of Rochester.
Thank you, Dr. Mayo. Pleasure to be here with you, Dr. Mendoza and Kathy Paranello, and I too want to thank the media for bringing this important message to the public. As you've heard Dr. Mayo, Kathy Paranello, and Dr. Mendoza explain, today COVID is no longer the virus causing the most or only concern as we head into the winter months. Strong currently has 140 patients who have tested positive for COVID as inpatients. However, only 20 of those patients are hospitalized because of COVID. The rest were found to have COVID incidentally when they were admitted for other reasons. This year, we're seeing a significant increase in RSV cases. Among our pediatric patients, this virus is up more than 50% from this time a year ago. We're just beginning to see cases of flu in our community and hospitals, but we know this year's strain of flu is particularly dangerous. Our healthcare teams are working heroically to maintain the high quality care for our patients who need it. But that will be hard to sustain if our community doesn't help. Our ability to meet demands for elective surgical cases is already strained. And a total pause in elective surgical cases is possible unless things improve. There are several ways the community can help. If you have not already done so, as you've already heard, please get your flu shot and see that members of your family are also protected by the flu shot. If you are eligible for a COVID booster, get protected from COVID. While you've heard fewer patients are admitted to the hospital with COVID, we're still seeing admissions, and boosters can help protect you from getting admitted to the hospital. Pay attention to your overall health. And if you have a problem, don't wait till the health issue becomes an emergency. See your primary care doctor promptly. MyChart and telemedicine have become important ways for patients to stay in touch with their healthcare team during this pandemic. If you need care but aren't having a true emergency, consider alternatives to the emergency department. Your primary care physician, for one, urgent care, or telemedicine services. We've seen throughout this pandemic that the community support makes a huge difference in weathering every challenge. I want to thank our incredible team of doctors, nurses, and staff members for the work they do. And on behalf of everyone in the medical center, I thank the community for your support. I'll send it back to you, Dr. Mendoza.
Thank you again to Kathy Parinello, Rob Mayo, and Mike Apostolakis for your ongoing partnership throughout the recent weeks, months, and years. So one more time, please get your flu shot as soon as you can. If eligible, get your COVID vaccination or booster. Please be attentive to hand hygiene and consider wearing a mask, especially if you're at risk for hospitalization or serious illness. And finally, please stay home if you are sick, even if you test negative for COVID. With that, I'll turn it back over to Julie, who will help handle questions from our media partners. Thanks.
Thank you, Dr. Mendoza. Our first question comes from Spectrum. I'm not sure if they have a reporter on. Spectrum, do you have a question? Next up, we have Raquel Stephen from WXXI. Raquel.
Yeah, thank you, Julie. Good afternoon. My question, you can tell my voice is kind of out of there because I think I have RSV as well, so I'm working from home. So I'm Exhibit A. But as far as, oh God, I missed my question. As far as capacity, so are we saying that the hospitals are not at capacity? There is still beds available, but we're almost at capacity. Can we clarify whether each hospital system is at capacity or not?
Yes. I'm happy to begin to answer that. And certainly at the UR Medicine Hospital, Strong and Highland, we are over capacity. We have more patients than our licensed beds would normally have us experience. The reason, though, is, as you heard Dr. Mendoza and then I alluded to, the reason we're over capacity is because we have such large numbers of patients that should be discharged, but they're awaiting nursing home placement. If we could get all of those patients out to nursing homes, we would have more capacity.
Yeah, thank you, Kathy. I think that explains well and fully the situation across the community, including Rochester Regional Hospitals as well.
Thank you. Do you have a follow-up, Raquel?
Yes. As far as other hospitals outside of the county, is moving patients to other hospitals being talked about, since Monroe County has experienced the most? You said, Mrs. Parinello, that Monroe County is experiencing the most overwhelm as far as hospital capacity. So is there a possibility that patients can be moved to hospitals outside of the county nearby?
Yeah, go ahead.
Yeah, sure. One of the challenges we're having, and you probably heard me say that Monroe County is more of a challenge, but the entire Finger Lakes area has fewer beds per thousand population than other parts of New York State. So really across our region, we're starting out with beds that typically are 90 to 100% occupied. So this influx of nursing home patients or these nursing home patients getting kind of hung up, so to speak, in the hospital has really created this dilemma. And some of our regional hospitals have the same dilemma. They are sitting there at 90% of their occupied beds and also have patients, not as many as we do because they're much smaller hospitals, but they have patients waiting nursing homes. On occasion, we have been able to send some of these patients to those regional hospitals. The challenge is many of these patients live in Monroe County, and sending them out for weeks on end to outlying areas can be challenging for families and for the patient, him or herself.
Yeah, Rochester Regional Health daily assesses the flow and balancing of patients. So based on the needs of patients, the request for transfers or higher levels of care, we are balancing which hospital can best serve that patient as well as manage their capacity challenges. So that's a daily assessment that we're doing. And we've been involved in that transfer and balancing process now for a number of years. That carries forward from years past, even before the pandemic started. It continued through that period of time, and still today we do this.
Yeah, I think like Rochester Regional, we have a centralized, what we call transfer center. And one of the things that we found more effective than necessarily transferring out of Strong is actually trying to keep patients in the local hospital by the physicians here in Monroe County at Strong being able to provide consultation and advice to the clinicians out in the outlying hospital. So that load balancing that Dr. Mayo references is really an important part of managing, our hospitals these days.
Thank you. Our next question is from Stephanie Dupree from WHEC. Stephanie, you're on mute. Okay, moving on. Do we have anyone from 13 WHAM? Or are you just recording?
Yes, can you guys hear me?
Yes, we can. Could you identify yourself too?
Yes, I'm Cheyenne Walker with 13 WHAM. Thank you, Julia. I had a question for Rochester Regional Health. Last week we spoke with you all and you said that your pediatric room was seeing 90 to 100 patients a day. Has that number increased a week later?
The numbers in the pediatric ED have been high over the last several weeks, and those numbers have remained very similar this week compared to last week.
Okay. And then I did have a follow-up question about the nursing home transitions there. How long do you guys estimate it will take to get these individuals out of the hospitals and into a nursing home?
Well, I think that depends on the initiatives that I spoke about. As I mentioned, it is going to take helping the nursing homes get a higher rate or financial support for taking care of these patients. And also, it's going to take creating a stronger workforce for the nursing homes. So the grant that I mentioned that the county has awarded the two systems is to help prepare certified nursing assistants. And those tend to be about 4-week training programs. And so we are going to be providing opportunities for individuals in the community to do that training and accept jobs in nursing homes. That, will take several months, right, to get enough staff members available to add the staff that's needed in these homes. The second piece is providing that direct financial support to nursing homes that will take these patients that have been waiting. So it is a month, 2 month, 3 month. It will be an ongoing effort that we are doing in partnership with our nursing homes. Our team has begun to talk to many of the nursing homes who are very interested in participating in this, as long as we can provide assistance with getting them staff and getting them funding.
Thank you.
Okay, our final question today comes from Isabel Garcia at WROC. Isabel?
I don't have those numbers at my fingertips, but I will say there have been many patients that have waited 12 hours or more that are admitted and they're waiting for an inpatient bed. Now, I'll clarify that by saying if the patient has an urgent heart attack, has a traumatic injury, needs to go to the operating room, has a stroke, and needs to go elsewhere for a procedure. Patients that can leave the ED for urgent procedures, they tend to leave very quickly. Or if the patient needs an ICU bed, tends to be able to leave very quickly. When that person needs a regular med surg or a floor bed, that's when they have the longer delays in the emergency department. Now, they receive care from the emergency nurses and our physicians while they're in the emergency room, but they often are doubled up in rooms that used to be privates or are waiting in areas in the emergency department hallway.
And I'd just like to emphasize the fact that if you come to any one of our facilities at UR Medicine and have a stroke, a heart attack, or any critical illness, you do not wait. You get immediately to the critical care area and get immediate care. The patients who are waiting have been triaged based on their symptoms as to that they don't have critical needs. And sometimes patients do wait much longer than we'd prefer. And that's why we're encouraging people with non-emergent issues to use their PCP's office, go to urgent care, or use telemedicine visits to help prevent the overcrowding in the ED so that people aren't waiting untoward hours.
I think absolutely, if you have an urgent problem that needs immediate attention, please come to the ED because you will get timely care.
I would say that our quality of care has been maintained. We are very concerned about overburdening our healthcare system. And what we're trying to do is make sure we give the very best care to our community that they deserve. If we have to pause elective surgeries, you could consider that a drop in our ability to provide healthcare. But we would only do that if it was necessary to take care of urgent and emergent needs. So it becomes vitally important that we partner with our community, that people get vaccinated against COVID, that they get vaccinated against the flu, and that they use the emergency room for urgent and emergent matters. That way, we can continue to provide all the health care that our community deserves and we'd like to provide to them.
Yeah, I would say quality, maintaining quality is of utmost importance to the health system and to all of us in healthcare. And so we do have very large data sets that we're tracking constantly to observe trends, to respond. If we see any changes in trends, you may guess that these trends do fluctuate up and down at times. And so we respond to those changes, and we are wholeheartedly committed to the highest quality of care that we can provide.
At present, we have no immediate plans to pause elective surgeries. Part of the reason for this press conference was to notify our community of our concerns that that's a possibility, and we'd like to partner with our community to prevent any pause in elective surgeries. And I know our community has stepped up time and time again, and I'm very hopeful that they'll step up again and make sure that they and their families get vaccinated for flu, for COVID, and work with the health systems closely to assure they use every mode of healthcare, including their PCP office, urgent care, telemedicine, to prevent overcrowding in our emergency rooms so that we can continue to provide the highest quality of care.
Yes, Rochester Regional utilizes similar approaches where we are daily assessing our inpatient census, our ED census, our scheduled surgeries. We utilize our ambulatory surgery centers to their utmost to shift patients to those environments that do not need a surgery in a hospital. And in this way, we've been able to maintain our surgery schedules. But there may be days here or there, periodic days where surgery schedules may be adjusted based on volumes, but it's not a wholesale consistent, change in the way we're operating. Yeah. Patients that come into the hospital with critical illness sometimes have unpredictable, changes in their care, and at times patients can pass away in various areas of the hospital. And I think over the history of our hospitals, that has occurred on rare occasions. But I believe that can happen in other healthcare settings. It certainly happens in all aspects of life where people can collapse unexpectedly in, wherever they are. But that always remains a concern, that we are being ultimately vigilant in assessing patients and delivering the care that they need.
Yeah, I think it's important to note, just as Dr. Mayo said, that a requirement and that we all meet, all the hospitals in Rochester, is a very quick but comprehensive assessment of the patient upon triage. So when we say a patient might not get into a room right away, we don't mean that the patient won't be assessed right away. Patients are assessed upon entry to the emergency department by a professional. And that often, that decision results in a patient waiting to receive care a little later or receiving care immediately. So it really is important for the public and everyone to know that in all of our hospitals, patients are assessed upon arrival for the level of illness that they have and the urgency of the problem they present with.
Okay, before we wrap up, I want to just double check WAM 1180 is on, and I believe they were going to submit their questions via the chat, but I just want to confirm that. Any questions from WAM 1180? We'll take that as a no. So that wraps it up. Thank you all for joining us today.